Hello everyone, you're welcome to my YouTube channel. This is Stephanie again. Okay, in today's video we're going to be talking about iron deficiency anemia. Like we said in the last video, we spoke on anemia, the types of anemia, and iron deficiency anemia was one of the type, which is the most common type of anemia. So we're going to be talking about iron deficiency anemia. We're going to talk about the cause, what causes iron deficiency anemia, the signs and symptoms, the ways to diagnose, to confirm that someone has this anemia, and also ways to treat or to manage this anemia. Alright, iron deficiency anemia is the most common type of anemia that occurs in most individuals. Okay, this actually occurs when the electrolyte count, that is when the red blood cell count and the hemoglobin are both reduced. Now we're going to move down now to what are the main causes of this iron deficiency anemia. We're going to have three main causes of this iron deficiency anemia, and under the three main causes we have what actually causes it. First, we have decreased intake of iron. Like you can have gastrointestinal surgery. That is, when surgery is being done, there is decreased intake of this iron supplement. Okay, the second that we have under this decreased intake of iron, we have malabsorption of iron supplement. All right, the last one that we have is low dietary iron consumption. That is, when you don't take enough food that actually will increase iron in your body, you definitely lead to iron deficiency, which will lead to anemia, iron deficiency anemia. All right, the second cause, we have increased loss of iron. The increased loss of iron, you have hemorrhage. There is, you like something like the postpartum hemorrhage, like excess bleeding. Heavy menstrual bleeding is the second. Heavy menstrual bleeding can lead to iron deficiency. And third, we have hemolysis. All right, the fourth, we have gastrointestinal bleeding. There is when you have something like an example, you can have peptic ulcer, which can definitely lead to iron deficiency anemia. Right, the next we have urinary losses. The next we have chronic nose bleeding, and the last that we have there is acute bleeding. It can definitely lead to iron deficiency anemia because there will be loss of iron through the bleeding or through the blood being lost. All right, we're going to move now to the last cause of iron deficiency anemia, which is increased utilization of this iron. Like when the iron is in the body is being used, is being used excessively. First, we have like during pregnancy. When a woman is pregnant, the baby also needs the iron, so the iron deficiency of the body actually reduced. And also the second one, we have growth. Like when the baby is growing, the body actually needs iron. The body actually needs iron when the baby is growing, and also when an adult or a child is growing, this your body actually needs this iron when you're actually growing. These are the main causes of iron deficiency anemia. So now we're going to move down now to the signs and symptoms of iron deficiency anemia. But before we move down to that, if you're new in this channel, do well to subscribe, like, and also share my videos, and also don't forget to ring the notification bell for more of this video. All right, so now we're going to move down now to the signs and symptoms of this iron deficiency anemia. The first sign and symptoms, we have fatigue. The second, we have pallor, which is the interior become more pale. The third, we have leg syndromes. The fourth, we have angular cheilitis. There is crack at the side of the mouth. Okay, the fifth, actually, yeah, we have weakness. The individual become weak. All right, the sixth, we have dyspnea. There is difficulties in breathing. All right, the next we have poor concentration. That is, the individual actually loses concentration. And the last we have pica, which is cravings to eat ice. That is, the individual actually have the cravings to consume ice. So those are the signs and symptoms. Those are the few signs and symptoms of this iron deficiency anemia, and there's so many of them, but those are the few that we're going to name here. All right, we're going to move down now to the diagnosis, like how to confirm that an individual has iron deficiency anemia. To do complete blood count. Second, you can do bone marrow biopsy. Okay, now we're going to move down to the last part of this video, which is the treatment or the management of this iron deficiency anemia. First, we have you identify the cause. What causes this iron deficiency anemia, and treat. First, like maybe it was due to heavy menstrual bleeding. You can make sure that you see a healthcare provider for that. Okay, it can also be caused by, let's say, it can also be, let's say, maybe it was being caused by nose, chronic nose bleeding. You also make sure that you see a healthcare provider for that. Okay, second, you increase intake of food that contains iron. Example, you have egg. You have egg yolk. The second, you have shellfish. You also have milk. You make sure that you consume that, and also you consume green leafy vegetables and fruits. All right, the third, we have ferrous sulfate. There is an iron oral iron supplement that is being taken by mouth. You consume that, and before you take that, you make sure that you take that with food to prevent gastric irritation. What the healthcare provider can give you a injectable or parental iron supplementation. Example, dextran. All right, so those are the various treatment or management, or how to manage this iron deficiency anemia. One of the side effects that we have for this ferrous sulfate or the dextran is that your stool become black in color. So don't be surprised if you're taking this drug and you're surprised and your stool is black. Don't be surprised about that. All right, see you in my next video. That is all what we have for today's video. Thank you for watching.